All right, sir. My name is Ram Jadan. I'm a family nurse practitioner student at United States University. I'll be doing a 2 exam for my school purposes. Basically, it's a mock exam. So, for that, if there's any finding, you go see your primary care physician because that's just a mock test. Okay. And are you the same person who gave the consent to record and upload the video YouTube as unlisted? All right, thank you. And you already signed the consent, so we'll go over the requirement on that one. So let's see. I have a checklist and the consent you sign. I'll upload all that and my ID and stuff, whatever is required for the school. And I'll also do the integrity pledge for my school. So I'm pledging that I'm using no outside resource as per my school policy. So that's my pledge that I'm using no outside resource and I'm doing as per the university requirement and not using any outside resource. All right. So we'll do the 360 scan and then we'll start the exam soon. I'm gonna put these papers somewhere here. So maybe put it down. All right, and I'm gonna show my dump sheet here. This is a blank, and my ears, there is no hearing devices. By this ear there is no hearing devices. I also do the 360 scan of the room. There is nothing here, and up in the ceiling, down on the floor. Also take my camera here. Just have my blank paper and my other supplies I need. And on the phone is I have a timer there. There's nothing, and I'm not going to use any drawer or anything, so it'll be as it is. So we'll start with the exam here. uh, now uh, my timer will start. Let's say it's 5:35 right now, so I'll do my preparation for the exam. Okay, I'll go with it. System. All right, sir. So I'll start asking some questions. So for this visit, you are just here for wellness visit, right? Okay. Can you tell me your full name and
Anand Shekhawat,
date of birth
was January 1973.
and your gender by birth and
Male
prefer-
and
male and male?
pronounced as
Okay. So now, so you're for a wellness exam, but if you're here for any actual other complaint, so I'll establish HPA asking old card. So that's basically asking questions about your um, onset, onset location, and duration, characteristic, character, elevating and relieving factor, any associated symptoms, aggravating and quality of pain, and stuff like that. And then any treatment you took for that. Okay. I'll be asking some question for your past medical history. So for that, when was your last eye exam?
December 23.
Anything wrong with that?
No, okay.
And last dental exam?
Again, December 23.
Anything wrong with that?
No.
When was your last uh, what is that? Eye exam, right? Eye exam I ask, and dental also ask.
Yes.
When was the last physical?
Physical was June 24.
Anything wrong with that?
Oh, no.
Nothing. Okay. Do you have any chronic illnesses like Crohn's disease, diabetes, or
No.
okay? If you do, then I'll be asking, what treatment you're taking and how the treatment is working. Do you have any psych history like anxiety, depression,
No.
something like any hospitalization related to that? No. How about any allergy with food, drug, or
No.
environmental allergy?
No.
Okay, so no allergy with anything. Okay, if you do allergy, then I'll ask, what kind of symptoms you're getting with the allergy, hives, or whatever. Any history of surgeries in the past?
No. No major
No
surgery.
surgical history. If you do, then I'll be asking about, about the surgery, any complication with anesthesia. What about medication? Do you take any medication?
No.
Okay, if you are taking medication, I'll be asking name of the medication, route of medication, and dose and reason for taking it and your compliance with it. All right. How about do you have any hepatitis B or HIV, something like
No.
that? No history. Okay. Are you updated with your childhood immunization
Yes.
and flu and COVID vaccine?
That is also good.
Okay. How about any injuries or hospitalization?
No.
No. Okay. So now, since you are a male for your age, I'll be asking like to do this testicular self exam and breast self exam, and that's you should do like every month. Get into the hot shower and come out and palpate your testicles with your hands for any nodules or tenderness or any asymmetry. And same thing you can do for your breast. Lay down and then palpate for any discharges and any nodules or tendons. Okay. And for if you were for a female of your age, I'll be asking LMP and menses character pattern, gravida para, pregnancy status, and if they're menopausal and in pregnancy plan. How about your sexual preferences? You prefer male, female,
I'm
or
straight.
you're straight? Okay. Do you have multiple sex partners?
No.
Do you use something for to protect sexually transmitted infection?
Yes.
What do you use?
Condoms.
Oh, thank you so much. Okay. Now I'll ask some social history questions. Your place of birth,
It's India, Rajasthan,
your race and ethnicity.
Asian, South Asian.
Okay. You married?
Yes.
Okay. Your occupation?
I'm into IT.
Okay. What about your military history?
No.
Okay. What about your housing? Do you live in a townhome,
Yes.
condo, or you have your own house?
Own
What kind
house.
it is?
It's like
Single family home
single
or
family.
single
Yeah,
family?
single.
Okay. So, how about tobacco use, alcohol
No,
use?
I don't.
Any drugs,
No.
marijuana or something
No.
like that? Any vaping? Oh, yeah. Tell me about your hobbies.
I like playing sports.
What?
Pickleball in particular.
Okay, good. And how about your habits? What is your diet like? Vegetarian, non-vegetarian?
Vegetarian.
Do you have enough fiber in your diet?
Yes.
You hydrate well yourself?
Yeah.
Okay. What about your emotions? Do you have any distress going on? Any
No.
stress? Do you get enough sleep?
Yeah.
Okay, that's good. How about I'll ask some violence question. You think you're being abused?
No.
Okay. What about do you seat belt when you're
Yes, I
driving?
do.
And do you have a gun in the house?
No. I don't
Okay,
have
if you do, then you should be putting it under the lock, for the safety. Now I'll ask you some questions about the grandparents. So you said you're married and you have kids?
Yeah, I have 2 kids.
2 kids, okay. And how old are they?
One is 17, one is 10.
They're healthy?
Yes.
And how about your mom? She's healthy?
Yeah.
How old is she?
Oh, 70 plus?
Okay, and how about your father?
Yeah, he's also 70 plus.
Okay.
He's also.
What about your mom's parents?
They are diseased now.
Oh, what is the disease? Can you explain? In
80 plus.
80 plus?
Yeah.
What was the
Late 80s.
cause of the disease?
It's AIDS.
They just died, natural cause. Okay. And same thing on other side of the grandparents, the
Yeah,
father
they're
side,
also diseased in 80s.
natural cause or any?
Natural cause.
Okay. Do you have any family history of early hearing loss or cataracts or glaucoma, like
No.
something like that? You have any family history of heart attack?
No.
Any family history of CHF, high cholesterol?
No.
Any family history of stroke,
No.
Parkinson disease?
No.
Any history of asthma, COPD,
No.
Any history of Crohn's disease, celiac disease,
No.
diverticulitis? Any family history of benign prostate hyperplasia like BPH or bladder cancer
No.
or kidney cancer?
No.
Any family history of diabetes mellitus or hypothyroidism? Do you have any family history of musculoskeletal problems like rheumatoid arthritis or arthritis?
No.
Okay, do you have and know if anybody in your family being obese, history of being obese?
No.
No. How about family of cancer, history of cancer in your family?
No.
Um, any kind of blood cancer or
No.
leukemia or
No.
okay. And do you have a family history of like bleeding disorders such as hemophilia?
No.
Have any family history of any genetic disorder like Huntington syndrome, cystic fibrosis,
No.
or sickle cell disease? Okay. Do you have any family history of allergies,
No.
hives, or any family history of non-allergy? Which
No.
okay. Do you have any family history of any drug use or any
No.
substance use? Okay. So now we'll move on to asking you question about yourself. Okay.
Mhm.
In that, I will be just asking, do you have any fever, chills, recent weight loss, or
No.
fatigue? Okay. Do you have any problem with the eyes, discharges, burning eyes, itching eyes, or anything like
No.
that? Do you have any problem with the ear, hearing problems, or any earaches, or any blockage in your ear, or something like
No.
that? Any problem with your nose, discharges, swelling,
No.
itching, any congestion? How about your mouth? You have any trouble swallowing or chewing?
No.
Any dental problems?
No.
Any gingivitis or something?
No.
Okay. How about you have any chest pain or palpitations?
No.
Okay, and no arrhythmias. How about you have any history of like, do you feel any dizziness
No.
or any one-sided weakness or numbness anywhere?
No.
Okay. Trouble breathing or any cough,
No.
congestion? Okay. How about your bowel habits? You having bowel movements regularly?
Yes, regular.
Any
I don't have
constipation
any constipation.
and diarrhea?
No.
Blood in stool?
No.
Okay. How about you have trouble urinating?
No.
Any pain during
No.
urination? Okay. Um, how about you feel being too hot, too cold,
No.
too sweaty? Okay. How about any joint problem, any range of motion problem, or any muscle
No.
pain in your
Nothing.
joint? Okay. And how about any recent weight gain, weight loss?
Mhm.
Any do you have any bruising problems or bleeding too long?
No.
No. You have problem with any wound healing or something like that?
No.
All good. Any new allergies,
No.
hives or anything? Any hay fever?
No.
Okay. So now we're done with this history part of it. So we'll move on to the physical exam. So before that, I will wash my hands. I'm verbalizing. I'll go wash my hands and then I'll start checking with vital signs. I'll check your blood pressure when sitting and laying down. Okay. And your height is 5'11, your weight is 175, your BMI is 24.4,
Yes, that's right.
and your blood pressure is 120/80, your heart rate is 80, and your respiratory rate is 16, and temperature is 98.6.
That's right.
Okay. Now I'm just in general, I'm inspecting you. Your posture look right. You look healthy. You're not malnourished or anything. I don't see any visible abnormality. Your mood and judgment to me looks intact, and you're making nice eye contact. So which I can see and you're making sense. I will ask some questions anyway. You know what date is today?
Today is 20th.
Okay, October 20th.
Yeah,
Okay. You know what city it is?
it's Sanford.
Sanford. Let me ask you some question. Who was the president during 9/11?
Bush Jr.
Okay. What would you do if you found a wallet on the street?
I try to find out the phone number and income tax
Okay.
details.
Great. Now I'll start the inspection with for your hairs, skin, and nail. So I'm just looking for a hair distribution, which is nice. I don't see any visible scaling, any dandruff or anything. And looking at your ears and overall skin, can look at your nails. No clubbings, no splittering here, no, and no fat pads under your nails like in COPD. So I don't see, and then I don't see any vestibules or macules. If I do, then I'll be grading according to A, B, C, D, E. There's A for asymmetry, B for irregular border, C for change in color, D for diameter, and E for evolutionary changes. So I'm done with the inspection of your hair, skin, and nails, and I don't see, no scars, no signs of trauma or anything. Now I'll start palpating your head and palpating your head for any signs of trauma, any scaling, any lesions, or any signs of injury, a nice hair distribution, no alopecia or anything. I'm also palpating here and checking for the peripheral refill. It is less than 3 seconds, and so that's good. And there's no tenting in your skin, so that's good. And I'll also now can you turn around? So okay, so I'm checking your frontal sinus. Any pain here?
No.
No. And your maxillary sinus, any pain here?
No.
Okay, that's good. Now I will be doing some, I'll do your lymph nodes here, and then I'll start with your examination of your eyes. So I'm just gonna palpate while I'm doing all that, because I palpated the face for symmetry and inspected also. I don't see any abnormality. So TMJ joint, can you move your jaws for me up and down also? Okay, good. So I can see TMJ joints, and then your temporal artery, I can feel it, and it's 2 plus strong. And also checking for your lymph nodes, preauricular lymph node, postauricular lymph node, occipital lymph node, palpating these, and tonsillar lymph node, submandibular and submental lymph node, and supraclavicular and infraclavicular lymph node. So there is no signs of tenderness or swelling or anything bigger than normal size. And their axillary lymph nodes, and there's kind of a pea size which is normal, and epitracheal lymph nodes, they are also there's no swelling or tenderness or any big nodules to be. So now let's going back to your eyes. I'll start inspecting your eyes just in general. So I'm looking for your upper eyelid and nice hair distribution. I don't see any blue pruritus. Looking at your conjunctiva, yes, there's no injection. Your sclera looks white, it's not yellow or anything. The cornea, sclera, and then your lacrimal duct on both sides. I don't see no problem there. So now I will, and I don't notice no nystagmus while I can look at your eyes. So I'll be checking your pupils for Parla pupil equal round and reactive to light, and also for accommodation. So just look to my pen and then look in the wall, okay? And look for, so I can see your pupil constrict and dilate just for accommodation, and your pupil with light. Yeah, so is they dilate and then go constriction, they go up to like 3 mm. And I'll also look for direct and consensual reflex. When doing my light here, I see other people constricting. Light here, I see other people constricting. So that's direct and consensual reflex. Now I can go ahead and do the some test for your eyes. So that will take care of one cranial nerve. That's cranial nerve 2, optic nerve. For that, I'll do the Snellen chart. Uh, so I'll have you read this about 6 feet, and for the clinic I'll do it 20 feet. So close one eye, read it for me.
LTFPS.
Okay, and then other eye. Okay, with both eyes.
LTFPS.
Okay, so that's your visual acuity, and then vision is good, your optic nerve is fine, and you can see just fine. And I can also check 3 more cranial nerves while I'm doing this. That's 3, 4, and 6. There's oculomotor, trochlear, and abducens. For that, I'll use the 6 cardinal gauge. So just don't move your hand, just follow my finger. So all 3 cranial nerves I just mentioned are intact. Okay, now I can also check your cranial nerve 5, that's trigeminal. So for that, I'm gonna have you close your eyes and you tell me where I touch. Okay.
Mhm.
Okay. Now tell me if it's sharp or dull.
dull,
Okay. How about now?
sharp,
How about now?
dull.
Okay, good. So your cranial nerve 5 is intact. I can do one more test for that. Just open your jaw against resistance. Okay, so that's good. Now I'll move on to um, I'm palpating your nose. Okay, and also palpating your ears for any tenderness or anything. So that's good. I'm gonna now start test for your ears. So there's three tests: whisper test, Weber test, and Rene test. So in whisper test, I'll just whisper some words and you tell me what it is. I'll close the ear here. One, two, three.
1, 2, 3,
Okay. And five, six, seven.
5, 6, 7.
Okay. So your gross hearing is intact, and so that's cranial number 8, acoustics. So we're testing that, which so far is intact, and then you see if you any lateralization of the sound here. That's for Weber test. Both sides or one
Yeah,
side?
both sides.
Both sides. So that's good. Now I'll do the Rene test. So let me see when you can hear it and when you stop hearing it. Let me know.
Yeah.
Okay. Okay. Can you hear it still?
Yeah, I can hear.
Okay. So that's good. Same thing. Let me know when you stop hearing.
Yeah.
Can you hear
Yeah, I
now?
can hear.
Okay. So the Rene test is negative. So air conduction is better than bone conduction. So that's part of that. And then now I will also actually do the ophthalmoscopic examination of your eyes. I did already inspection and looked into your eyes. So for that, I'll be looking into your eyes. I'll be turning light off and then looking for inside your eye. Okay. So you let me know if you. Oh, I'll let you know basically. I'll be using my right eye to look into your right eye, left eye to look into your left eye. And if there is abnormal finding, I'll let you know. I'll be bracing this ophthalmoscope for safety. So my right eye and your right eye. So I'm looking. I can see the I can see a sclera cornea, and I can see the red reflex now. I'm looking medially. I can see the optic disc and the cup, and I can see the macula and fovea, and the optic disc is sharp, and there is no cotton wool spots or any AV necking. So that's good. And your disc to cup ratio is like cup to disc ratio is uh, like 1:2. So that's optic disc and cup ratio. So his cup is kind of smaller. I'll check the other eye with my left eye, bracing for safety, and again looking for the red reflex, and then go medially and look for optic disc. So findings are same as other eye. So I'll wrap it up with that. So we did cranial number 2, 5, 3, 4, and 6, and cranial number 8, acoustic. Now I can do uh, actually I'll start with the ear, and then I'll go for move to test your nose. We already did the palpation, so we just have to do look inside your nostrils, septum and turbinates. First, I'll start looking into your ear. Okay, so I'll pull your ear up and back, and safety. I brace it and look into your external ear, and I see no swelling or any erythema, and no cerumen, and no discharges. Your tympanic membrane I can see is pearly gray, and I can also see embo and handle of the malleolus, and mm, and the cone of light at 5 o'clock here. Okay, and then I'll look into your other ear, same thing with the safety, external ear and the internal the tympanic membrane. So only difference is our findings are same. So the cone of light is 7 o'clock on this side. That's the only difference. Otherwise, same as other side. Now, while I'm doing that, I can look into your nose also. So using bracing again for safety, looking in your septum and turbinate. I don't see no discharge, swelling, or any polyps on this side. It's clear. And then other nose, same finding on other side also. So that's the exam of your nose, and I can do the olfactory cranial nerve 1. For that, first let me have you breathe in and out with one nose, other one. Okay, so your nasal passage is clear, you can breathe just fine, it's patent. And can you close your eyes and close one of your nose, and I want you to smell something and let me know what it is.
Curry leaf.
Curry leaf is correct. How about your other nose? Now let me know. Okay, thank you, that's correct. So that's your olfactory. Now I'll go ahead and look into your mouth. So for that, I will inspection I'll do first, and then palpation also I'm supposed to do, but when we going inside. Let's see. Open your mouth for me. I'm looking for. Can see your soft palate and hard palate. I can see your dentures, and stick your tongue out side to side. Can yes, other side also. No leukoplakia or no erythema. I can see no dental caries, and I can see the uvula, and I can also see your tonsils. Can you say ah for me? I can see your uvula rising, and I can see your tonsils. I'll grade them 1. And can you swallow for me? Okay, so I'm also, while I'm doing that, I'm looking for cranial number 9 and 10. Okay, it's glossopharyngeal and vagus nerve, so which are more intact here. And I'll also do cranial nerve 12. That's hypoglossal. So can you stick your tongue out and push against your cheek, side to side? So that's good. And I'll also do cranial nerve 11. That's spinal accessory. For that, I'll do the soldier shrug, soldier spoon. Okay, and push it forward, backward, and side, this side. Okay, so that's trapezius. So that's good. So cranial nerves are pretty much all taken care here. Now I'll just start inspecting your so I did your eyes, ears, nose, and mouth. We'll move on to your neck. So I'm just inspecting for any tracheal deviation, any swellings, any edema, nodules, or anything anteriorly. Don't see any. And I can also palpate here. I don't see any problem. It looks midline to me, but I can do actually palpate your trachea going behind, and have you swallow it. The trachea is midline, and I can move it side to side. And also let me look for cricoid cartilage here. I'm also looking for your thyroid gland here. So no nodules or swelling or anything. Can you swallow for me? I can feel the borders, and I can push side to side. So that's both of your glands. So now I can also have you do for your neck movement, and there's a range of motions. So can you do flexion, extension, rotation, and then okay, lateral bending. Okay, so that's good. And you already did with the resistance. I check your strength is 5 out of 5. So all angles, and then can you rotate on that side? Okay, other side against resistance. Push it. Yes, yes. Okay, and then put it down. Okay, back. All right. So now I will go ahead and move to your anterior and posterior chest exam. So I'll generally just doing my inspection. Uh, um, Here. So by the way, did I mention the optic disc and cup? So there was optic disc cup to ratio is like 3:1. Okay, disc to cup ratio is 3:1. Just wanted to correct myself here. And now I'm inspecting anteriorly, posteriorly, looking for any signs of cyanosis. Your skin color is nice, no yellowness, cyanosis, or any intercostal retractions, and you're not using any accessory muscles. So that's good. And While I'm inspecting, I'm also looking for your anterior, posterior, and transverse uh, ratio here, which is like 1:2, which is normal for patient in COPD. Their anterior posterior is more wider, so that's that. And now I'll start with my anterior chest for uh, palpation also. So I'm going to palpate here. Do you have any costochondral tenderness, any pain here?
No.
No crepitus. I'm palpating, so I don't feel any, and hips or lips. Same thing I'll do posteriorly. uh, I'm palpating your rhomboids and trapezius and all your paravertebral muscles. Okay, and then your C7. So done with my palpation. Now do my I'll do tactile parameters. For that, I'll be comparing sound from one side to other side. And for any, if you have consolidation, then I can feel the variation from one side to other side. So when I touch my hands, you just say 99. Okay.
99, 99, 99, 99, 99, 99, 99, 99.
So I'm avoiding scapula here. Okay.
99.
Okay. So I don't see no asymmetry, and then there not there are no such variations. I can feel the vibrations equally on each side. So now I'll do the percussion. So for that, in the percussion, I'm basically looking for any, again, you have any pneumonia consolidation. So then I can feel this. Usually, normally it's resonant sound. So if I percuss, if you have pneumonia, something, it's going to be more consolidated. So it's going to be like more less resonant, or it's basically kind of more dull. So I'll use my this finger, a middle finger on top of other middle finger. Again, I'm comparing both sides for any variation. And same thing on back, percussing using ladder-like pressing, avoiding scapula. Okay, so again, I don't think you have any consolidation. I can see it's all resonant, all the areas. So now I will start with my auscultation for your chest, anterior and posterior. So I'll be basically auscultating. So this is your tracheal area. So usually, normally you hear bronchial breath sounds. In your external area is going to be bronchiovascular sounds, breath sounds, and then in the lower periphery is basically vesicular breath sounds. Okay. I'm listen for the normal. I'm going to listen for the normal, but if there is anything abnormal, any crackles, wheezing, wet sounding sounds, again using ladder-like pattern. All right. And then you have three lobes on the side. Go back. So no crackles, no wheezing, clear breath sounds, no any chorus or uh, breath sounds. So that's the auscultation. So now I will go ahead and start with your with actually there's a couple more tests less for your uh, lungs. So for the chest expansion and then diaphragmatic excursion. So for the chest expansion front, I'll put my hands and you just breathe in. I see my hands going up, so that's symmetrical and nice. And also do the same thing for the back side. Can you have maybe you can stand up? Just stand up for me. Turn around. So go around the 10th rib. Take a deep breath. Okay, so that's good. I can see my hands moving far when you just stand there. Let me do your diaphragmatic excursion also here while I'm doing this. So I should be using my pen here. Okay. So now turn around. So, or I can just mask. I don't have to remove the clothes. So take a deep breath. So I'll find your lower border for dullness. So I'll focus here. You're holding a breath in, right? Okay, so yes, here is the lower border here. I'll remember that. And then now exhale all the way. Okay, so that is the area here. And I'm gonna measure that. So that's about 6 centimeters. So that's actually normal. No, actually, it's what is that? 5 centimeter, and yours are kind of egg, but some people can go up to like 3 to 7 centimeters. Yours is 5, so that's good. So we're done with the chest expansion, diaphragmatic excursion. Now I also listen to you. Now you can have a seat here, and then I'll listen to your heart. But before that, I'll be inspecting your chest for any heaps, thrills, any epicardial pulsation, ventricular pulsation, any visible pulsation, signs of trauma or anything. And then I have to show my markings here. So probably you wanna sit here. So yes, here. So I'll mark these so that I can auscultate later and don't have to verbalize every single time. That's your sternum. So for aortic area, I'll be basically I'm palpating your aortic area for any thrills I don't see, and that's located on your second intercostal right sternal border. And then for pulmonic area, it's gonna be your again second intercostal left sternal border. That's your pulmonic area or thrills. And then for your arch point, it's gonna be third intercostal space and left sternal border, and this is tricuspid, fourth intercostal space, uh, left sternal border, and then following the midclavicular line, fifth intercostal space. That's your mitral area, mitral valve, and that's where you can actually feel the PMI also. So I don't feel any thrills here while I'm palpating. I'll also auscultate all these areas with bell and diaphragm. Okay, before I do that, I can also palpate your carotids. So one at a time is both are 2 plus and no thrills felt, and then I can auscultate the carotids. I don't see no jugular venous distension, and I auscultate your carotid with the bell, diaphragm and the bell, no grooves, and again with the bell and diaphragm, no grooves. Now I'll start auscultating your uh, aortic valve. So when you're laying like this and leaning forward, you can listen for any kind of aortic insufficiency. In your case, I don't hear any. So that's aortic area, second intercostal space, right sternal border, and that's your pulmonic valve. I'm listening with bell and diaphragm, and then your ups point, third intercostal space, left sternal border, bell and diaphragm, and your tricuspid with bell and diaphragm, and the midclavicular line from the fifth intercostal space again with the bell and diaphragm. So I can only hear S2 and S3, no physiological splitting, no S3 or S4 or any murmurs. Now, since you are sitting, I'm done with now. I'm gonna have you lay down. So I'll go start with the abdominal exam, but I'll also listen to your heart sounds again while you're laying down. Okay. So put your legs. Let me put the pillow so your abdominal muscles can relax, and then you can put this up. So while I'm auscultating, I already auscultated your carotids. I'll auscultate. Actually, I have to do the inspection first. So let me do the inspection for your abdomen. I can see uh, is your midline is straight here, and your belly is rising symmetrically. I don't see any abdominal pulsation, abdominal aorta pulsation, or any signs of trauma or spider webs or any scars, lesions, or any signs of, again, signs of trauma, swelling, redness, erythema. Uh, so now I will start auscultating your heart valves. There's your aortic with the bell and diaphragm, pulmonic with the bell and diaphragm, and then your ups point with bell and diaphragm, and your tricuspid with bell and diaphragm, and then your mitral area, midclavicular fifth intercostal space, bell and diaphragm. And that's when you can also listen apical pulse. So again, no signs. Whatever I heard was previously, so there's nothing new on auscultation. Now I'll start auscultating for your abdominal aorta. It's around the umbilicus, a little bit on the left side with the bell and diaphragm. Now also listen to your renal arteries with the bell and diaphragms, right and left renal arteries, and then your iliac arteries with the diaphragm and with the bell, and then I'll auscultate your femoral arteries with the diaphragm and the bell. So I auscultated all your areas here. Now I'll auscultate your abdomen peristaltic movements in the normal active, hypoactive, hyperactive. Okay. So for that, I'll start with the right lower quadrant and listen for any high pitched sounds. The ball movement, peristaltic movements are like 5 to 34 per minute. All right. So that should be like, if it is more than 34, it's hyperactive, less than 34, hypoactive. So right lower quadrant, right upper quadrant, and then left upper quadrant, and then left lower quadrant. And can you take a deep breath here? I can also auscultate for any liver friction or any splenic friction here. So nothing there on my auscultation. Now I can actually do the uh, percussion for your abdomen. So for that, I should be hearing tympani all over unless there is some solid mass or something which can make it dull. And I will also be marking margins for your liver. So I should be hearing mostly when I percuss, it's going to be tympanic. So right lower quadrant, right upper quadrant, left upper quadrant, the bladder also. So that's, so it's all tympanic. I don't see no dullness. And can you take a deep breath? I'll try to percuss your liver also. I can. Okay, so I can hear the dullness here. So I'll mark that. That's a lower border of the liver. And let me look for your spleen around coastal margin, anterior axillary line, and 12th rib here. So it's tympanic. I don't see no here no dullness. Okay. Now also mark your upper border, following the mid-clavicular line, following the nipple here. So you can see the dullness here. So for that, I will measure it again. So okay, so your liver border here is 8 centimeters. So that's normal. About 6 to 12 centimeter people sometimes they have it. So we done with this markings. Now I will do my palpation. So when palpating, I'll start with the pulses for your abdominal aorta and make how wide it is. I can see there is no thrill on abdominal aorta, and it's like 2.5 centimeter width. And palpating your renal arteries, iliac arteries, no thrill, and both of the femoral arteries, no thrills. And I can also palpate for inguinal and lymph nodes. I don't see any feel any swelling or anything. And the now we're done with the pulp. Uh, oh, actually, now I have to do the lighter palpation and then deeper palpation. Okay, so lighter palpation, right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, and for deeper palpation, right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, so there is no abnormal mass or any findings there. Um, so that's good. So we did the palpation, and I can also palpate for the border of your liver. If you take a breath in, and I can feel your border here. So liver border. Okay, let me see if I can feel your spleen. Can you take a deep breath in? Okay, it's around the 12th rib here. Basically, is underneath. I don't feel it. I'll also palpate for your kidneys on this side using your both hands. The same thing, palpating your kidneys on the other side. And now, can you just uh, get up for me? I'm going to check your. Uh, have a seat. Look for your costovertebral tenderness. If you have any, kidney problems. So my camera, so do it as such. Move it. Okay. So again, I go around your find your vertebra, costovertebral angle, and a 12th rib, and then I'll put my hand. Let me know if you have any pain.
No.
Okay, so that's good. No costovertebral tenderness. So we're done with your abdomen. Now you can turn around. Now I can start with some range of motions and sensory part and all that. So let me do. Close your eyes for me and tell me if you feel dull or sharp.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull.
Okay, so I checked your upper extremities and lower extremities for sensation is intact. Now I can start with your inspection for your joints. So I'm inspecting all your uh, these DIPs, PIPs, and metacarpals, and carpal, metacarpals, and your all the elbows, anteriorly, posteriorly, and your shoulders, and then looking both sides. So there is no redness, erythema, and no clubbing, as I say, no jaundice or anything, no signs of trauma or any stress. And then for shoulders also, I don't see any sagging or anything. They're not flat or anything like in fracture or something. So the inspection part is done. I'll start with the palpation. I'll palpate your DIPs, PIPs, and your metacarpals. So distal interphalangeal, proximal interphalangeals, uh, carpals, and metacarpals here. Same thing. I'm palpating all the DIPs, PIPs, interphalangeals. I already did, and metacarpals, your wrist, and then your ulnar extension here, and then you're palpating for your medial epicondyle, lateral epicondyle, and olecranon process, lateral epicondyle, medial epicondyle, lateral epicondyle, olecranon process, palpating for any swelling, fluid collection, any crepitus or anything. And then there's golfer's elbow pain here. You don't have any in this area. Okay. And for your shoulders and suprasternal notch, I'll start palpating following your clavicles, and then go for summit of shoulder here for any tenderness or pain, and then look for acromion process and then acromioclavicular joints on both sides, palpating here, and then go under here, deltopectoral groove, and then I can palpate Corcoran process, lesser tubercle, greater tubercle, and then your biceps groove here. So, and then also I can see palpate for the rhomboids, trapezius here, the paravertebral muscles I already palpated. So now let's do the range of motion for your upper extremities. So make a fist and open it. Now try to close the fist against resistance. Make a fist and make a fist. I'll try to open it. Okay. You don't open it. I tried to open
Okay.
it. Oh. So you have strength 5 of 5. Okay, so far. So, and then you do the flexion, extension. Okay, and do this, do that. Try to open it again. Okay, now close it. Try to open them. Okay, that's good. Push it, push downward, and you flex your elbows, extend, pronate, supinate, and then flex again. Flex your elbows and press against resistance, push against resistance. And for shoulders, like try to do that from here. Okay, backward, forward. Okay, now we did the elbow and do some for your shoulder girdle here. So for that you do flexion, extension, abduction, adduction, internal rotation, external rotation. Okay, that's good. uh, for your neck, I already have you did all the range of motions, right? So now I'm gonna be moving uh, uh, for lower extremities, but before I do that, I'm gonna, can you stand up before I forget? So I'm gonna palpate for your hip joint here, anterior superior iliac spine, and then say posterior superior iliac spine, and that's your sacroiliac joint here, and then greater trochanter on both sides. No swelling, or I don't see any nodules or any crepitus here. And then I'll also um, so that's my inspection. Obviously I can see it, but I don't see anything, no redness, erythema, tenderness, swelling, and palpation. I did it. And then uh, I'll also do the some range of motion. But before I get confused here with all my part, I probably start with the, let's do let's do take care of, maybe come here so it'll be more visible. I want to do some you know have a seat. So now I'm inspecting your toes, feet, metatarsals, tarsals, and your both ankles, your lateral malleolus and uh, medial malleolus, Achilles tendon, and I'm also inspecting on callus, plantar warts, or calluses, and I don't see anything. And also here I can palpate for a motor neuroma, also inspecting for flat feet, nothing there. And I'm also inspecting your knees, and I don't see, and I can palpate your patella, upper groove, no fluid collection or denting here, and then laterally and medially I can palpate, there is no fluid or swelling. I can also go look for popliteal fossa here. uh, I can feel the popliteal pulse 2 plus, and I can also check for Baker's cyst if there's any fluid collection, no Baker's cyst here. And now I can have you do some range of motion for your knee. So straight, other one straight. Okay, now straight again against resistance. Okay, push it all the way. Okay, other one, push it down. Okay, the other one, push it down. Okay, so now can you do this with your, okay, good. And then same thing, now you can do just reverse of this. So that was basically adduction. For abduction, yes, and do this with the resistance. Okay, that's one also. And same thing, push inward. Okay, and then now I'll move on to your feet. So I'll do uh, dorsiflexion and push it down, plantar flexion, same thing, plantar flexion, yeah, dorsiflexion, and then rotate on side to side, same thing against resistance. And then can you do it yourself, all those things? Okay, rotation. Okay, good. Now I'll also check your dorsalis pedis pulses, both are 2 plus, and posterior tibial pulses, both are 2 plus. And then I'll do check the reflexes here, uh, which I haven't done so far. So I'll start with the upper extremity here. So looking for brachioradialis reflex, okay, and then biceps, and then triceps reflex. How about this? And then your plant patellar reflex. Okay, how about this side? Okay, and then I can also your Achilles tendon reflex here. Okay, so both of them, and then I can also do the Babinski reflex from the heel to the toes. Yes, yeah. So this is all good. Your reflexes are done. Now let's go back to your uh, spine. So can you, and then there's some range of motion for your hip, and then some cerebellar functions. So for that, stand here, close your eyes, put your hands like this. Okay, that's for Romberg test. So I'll watch it for 1 minute, and then you have your hands are going down on losing your coordination. So I'll watch it for 1 minute, and then for pronator drift, I'll just press both hands, and then if pronate, that's pronator drift test. So both are negative. Now you turn around, and can you bend forward? Okay, now I'm watching your hip joint and your shoulders for any you know symmetry. They're symmetrical. There's not like one falling, other one not falling. One hip is symmetrical. I don't see no problem. And your spine also I can palpate, and I don't see any problem. Stand up with your curvature here. Now let's do some range of motion here. Turn around. So for your hip, I want you to do flexion, yeah, other feet, flexion, okay. And then for extension, do this, okay, both feet, okay. I will do the same thing with the resistance. So pull it forward, push it, other one, push it, and then backward, and this one. And for adduction, you're gonna cross your legs. So yes, okay. So that's adduction, and for abduction, you do this. Yes, same. So I'll do this with the against resistance. Okay. Other one against resistance. Okay. And then for uh, external rotation, do this. And for internal rotation, do that. Same against with the resistance also. I'll have you do it. Yeah. And then this one also. Okay. Good. Good. So I think we covered most of it. Have a seat, please. Thank you very much for your support. So let's see. For neuro, we did all the reflex. Sensory, we did it. Spine, we did it. And I don't know, I think I covered. And for your feet, toes, and your hip, range of motions are all done. So your strength is 5 to 5, 5, 5, 5, 5 out of 5. All the range of motions, your muscle strength, and overall, uh, I think we did great. Probably it's taken care here. So I'll stop the exam here. I think I covered all of it. I don't seem to remember if I left anything behind. If I do, I have to record again, I guess. But no, I don't have to. Thank you, Professor.